Now, in this evening's edition of the Health Report, Shamila Pullen looks at cellulitis.
Cellulitis is a bacterial infection of the skin. While it is mainly seen on the lower part of one's body, like the legs, feet, and toes, it can appear anywhere. It usually comes with swelling, pain, and redness in the limb.
It becomes a problem in persons who are immunocompromised and are not able to handle simple infections or simple injuries. So, say, trauma would be a major risk factor for this. Fungal infections of the toes, so is also a major risk factor because there's breach in the skin integrity and bacteria can enter in that way. So diabetic persons are particularly prone, and other persons who may be immunocompromised.
Thinning of the skin can also happen to persons on steroids.
But also, and this is culturally very important, for persons who use skin lightening agents. Right, so a lot of these persons who you see rubbing ointments on their limbs to, bleach, these persons have increased risk because the skin is very thin and they are susceptible to infection because of the thin skin layer. And so they sometimes have very, very florid cellulitis.
Cellulitis can lead to sepsis and death. To diagnose the condition, a medical doctor will ask about symptoms and conduct a physical exam of the affected area.
So the diagnosis is pretty straightforward. Sometimes we want to make sure there isn't an associated clot to the limb because there's swelling. But generally these patients, the skin appears red, it's tender, it's warm to touch. So these are quite classic signs. And you may also see the breach in the skin. For some persons, you may see what we call fungal toe infection, the tinea pedis. If you look between the toes, you'll see the maceration and the break in the skin. Or you may see the ulcer, which is the main cause of it. And the treatment is quite simple. It's really appropriate antibiotic therapy.
With your health report, I'm Shamila Pullen wishing you good health.